We're set for a warm weekend in some parts of the country, but the disease is still spreading, and we absolutely cannot afford to relax the social distancing measures that we have in place. We cannot relax our discipline now. Coronavirus continues its grim march. I can report that through the government's ongoing monitoring and testing programme, according to the latest figures, as of this morning, a total of 173,784 people have been tested, of whom 38,168 have tested positive. 3,605 people have sadly died. And we're reminded again today that for the NHS, this truly is the front line. In the last 24 hours, 2 nurses and 2 healthcare assistants have tragically died fighting coronavirus. Today we've announced that we will begin the work on 2 further Nightingale hospitals in Bristol and Harrogate. The Bristol Nightingale will have a capacity of up to 1,000 beds, and in Harrogate a capacity of up to 500. Since the start of this crisis, we've boosted the number of critical care beds to care for coronavirus by over 2,500. That's before the addition we'll get from the Nightingale hospitals. And the result of this extraordinary work is that in every hospital in the country, we have managed to expand capacity. And as we stand today, over 2,000 critical care beds are free and available. And they're ready should they be needed. And that's before the Nightingale hospitals come on stream. Research about treatments is absolutely central to our plan. The UK, of course, has a long tradition that we're very proud of being the best in the world in this sort of science. And we are a world leader in clinical trials. And we're putting this to use right now, bringing together some of the finest research minds in the country to design new trials, and we're delivering them at record pace as well. We've established 3 national clinical trials covering each major stage of the disease: primary care, hospital care, and critical care for the most seriously ill. And just like the Nightingale, one of these trials was in fact put together in just 9 days, which is breathtaking speed. These trials are looking at the effect of existing drugs and steroids repurposed for treatment of COVID-19. One of the trials, which is called Recovery, which deals in hospital care, is the largest of its kind in the world, with 926 patients enrolled. We need more patients to volunteer to be part of these trials, because the bigger the trials, the better the data, and the faster we can roll out the treatments, if and only if it's proven to work. These treatments will help us as the science develops. But for now, the only way to protect yourself and your family from this disease is to stay at home. We're set for a warm weekend in some parts of the country, but the disease is still spreading, and we absolutely cannot afford to relax the social distancing measures that we have in place. We cannot relax our discipline now. If we do, people will die. So I end with the advice that we all know. This advice is not a request. It is an instruction. Stay at home, protect lives, and then you will be doing your part.